Probably have an old school website, just like this old school Voltron from the 80s. Here's the thing, video websites are dominating the entire internet right now, but only 3% of people have video websites. What is a video website? When there's continual movement. The beautiful thing about continual movement is that when you have movement, it keeps the buyer wanting to stay on the website. Here's the beautiful thing. If you look here at Dr. Mo's website, he is dominating. His website's everywhere. Not only that, but he's omnipresent. It's about time to get you out of the static world websites where they don't move, doesn't do anything for you, but come into the video websites where we dominate Google and get you omnipresent. It's time to step in the future of marketing. Make sure you click on the button in the bottom for a consultation, and we'll get back with you.
Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine Show. We are so happy to have you all out there on Instagram, Facebook, YouTube, Internet land. Today I have a special guest, Dr. Daniel Savarino. Hopefully I said that. It sounds Italian.
Oh, yes.
You're very Italian. Anyways, we have Dr. Daniel Savarino. Anyways, Dr. Daniel Savarino. And I'm excited because we here at Edge on Regenerative Medicine Show, we make sure that we deliver the best of the best in their field and what they do. And one of the things that we love about this show is that we're here to help people. The bottom line, there's a lot of people that are sick and they don't need to be sick. And a lot of them don't need to be in the hospitals. And of course, that's another thing. But today we're talking about Dr. Daniel. And one of the cool things, he has I believe you can find him at Ask Dr. Dan on Facebook and Instagram and YouTube. So he does, I believe, like a show. Is that correct? You have like a little show that you talk on, or?
It's a little question and answer. We propose a subject on Monday, and then we give you guys the week to give us some questions, and then on Friday we give you some answers. Yeah.
I love it. So you guys can go there at AskDrDan.com. We'll have the link down at the bottom. Not only that, but he's also a national speaker. You can also find him at Apex Center for Regenerative Medicine. This is in Tinton Falls, New Jersey. Hopefully I said all that correctly. And then you can also find him at his website at regenerate.enj.com. Hopefully I said that correct.
Regenerate NJ.
RegenerateNJ.com, just like MJ. And so the title today is I really love this title. It's called Keeping People Out of the Operating Room. So again, thank you for being on the show. And let's talk about that, Dr. Daniel, keeping people out of the operating room. What are some of the things that your office is doing to do that?
Yeah, sure. So, I mean, that's the goal of our practice. I am a primary care sports medicine doctor, so I train non-operatively. I've kind of worked with a lot of orthopedics over the years, though, and I've seen a lot of surgeries, and a lot of them I don't think really need to be done. You know, we specialize in regenerative therapies, so using things like PRP, stem cells, but also we specialize in minimally invasive procedures using ultrasound guidance that keep people out of the operating room. So we do procedures in our office through 3 to 5 millimeter incisions, you know, little pokes that don't even require a stitch that, you know, used to or still do when you go get them traditionally. They have a 3 to 6 inch incision and, you know, big recovery time, more likely to get infected, all sorts of stuff. So,
man, I love that. So as we're talking about keeping people out of the operating room, what are some of the, you said you were mentioning about PRP. What can PRP do for that you've seen that is help people to stay out of the operating? We'll just use PRP for an example, or even stem cell.
Sure. So PRP, which is platelet-rich plasma, which is taking your own blood, spinning it down, concentrating those platelets, which are your healers. Um, we basically take that and we put them into places that can't normally heal on their own or just have not healed, the way we had liked them. So for things like your tendons, your ligaments, tennis elbow, Achilles tendon, plantar fascia. These are all places that don't have a great blood supply, and the blood really can't get there in large amounts, which is why some of these don't heal properly. So basically what we do is we put the healers in places they can't normally get to in a large amount, and we facilitate that healing. So you can heal chronic tendinopathies, like what they call tendinosis. You can also even heal some partial tears. Even if a full tear is completely non-displaced and it's close to each other, you can heal small full tears sometimes just using that. As far as things like joints go, PRP can also sometimes heal some cartilage. I've had meniscal injuries that I've seen the meniscal tears on MRI. We've done some PRP. A couple months later, the meniscus is healed, and we don't have a radiologist in our group. No one's reading it. There's no bias. We've seen them heal. So when it comes to joints, though, I usually think things like stem cells are the more robust treatment. That's where I think for things like osteoarthritis, you're going to get the better results. PRP works and people do feel good because the PRP really will get rid of that chronic inflammatory process. But the stem cells, I just think, do it a little bit better.
Right. I know that they work a little differently. Correct me if I'm wrong, but with the PRP, I don't believe PRP can grow back like bone on bone or anything like that. Isn't that pretty much just the stem cell?
So even the stem cell, if you have a bone on bone situation, you're probably not going to really grow any cartilage back, just because there's no chondrocytes for that to feed on. If you have mild arthritis, sometimes you can put a little cushion back on the tire, a little tread back on the tire. But, really the goal is to get rid of that chronic inflammation and because that chronic inflammation not only hurts, but it feeds the arthritis too. So those chronic inflammatory cells go in there like little Pac-Man and they eat up that cartilage faster, so you're reversing that process. And then you're making them feel better and they have more motion and more mobility. So, it's like I always say, you don't treat a finding, you treat how they feel, right? So you can get an MRI or an X-ray and someone can have a bone-on-bone arthritis, but if they have no pain, are you going to do a knee replacement on these people?
Right.
Then you're going to spend 6 months to a year recovering when you didn't have pain to begin with, so.
Exactly.
Yeah, or if they had pain and then you get rid of that pain, but they still have a bone-on-bone knee, why are you going to do surgery? So.
No, definitely. It's funny what really intrigued me and I would say got me into stem cells and just that arena was Mel Gibson. When I saw the Mel Gibson video of his father, his father was like 90 years old or something like that. Now his dad's still living, is like 103.
Okay.
And no joke. And he was going to literally, the doctor said he was going to die. He wasn't going to live. And then at the time we weren't able to do stem cell injections here in the US. So of course he had to go somewhere. I think it was like Nicaragua, somewhere far away.
Yep.
And so, where he can actually get away with it. And so he did it. And his dad was like a brand new person. Now Mel Gibson's over here for himself. I think he carries like a man purse, he's not even joking, but it's amazing how stem cell has adapted to our world. I know that we're still in the infant stages, just in stem cell. I was playing video games with my son the other day, and not too good. And I'm playing, and I'm dying, and we have our little headsets on. He's like, "Dad, hit the O button." I'm like, "Okay." And when I hit the O button, it was a military game. The military guy pulls a syringe out of his pocket, which it said stem cell on it. And he himself, and he came back to life. And I'm like, son of a gun, they're getting our kids. So it's smart what they're doing because they're putting in the video games, and it makes sense. So in another 5 years, it's going to be like not a big deal, I believe.
Yeah, I would even say that stem cell hasn't even been delivered yet. I don't even
No.
think it's in its infancy. There's so many things that even we know we can do, but we can't do just yet. You know what I mean? So as this field grows, I think you're going to see a lot of changes. Unfortunately, we have to get past through some of these
Yeah.
restrictions that we have in place. But
No,
yeah.
definitely. What I love about stem cell, though, what I'm seeing is I'm seeing how a lot of doctors are starting to utilize stem cell with carrier stuff, where they're blending it with other stuff. I'm seeing a lot of doctors where they won't only do the stem cell, but they'll also slap in the PRP.
Yep.
So I mean,
That's how I do it. Yeah.
I love it because it's smart. It's like you got a painting on the wall. You don't want it to fall. You got the stem cell. Now you got the PRP. Now you're making sure that sucker ain't moving. So I love that.
Yeah, I mean, when you just think about it, you're taking all the good properties of the stem cells, and then you're mixing all those growth factors in with it too. I mean, it's just a win-win.
Let's talk about that stem cells. I know there's some people out there that have a misconception of stem cells, of what stem cells are, what stem cells aren't. We're taking baby. I'm hearing people saying, well, they're getting the stem cells from the baby or the umbilical cord. What is really so? What's the truth and what's really far from the truth? Would you say?
So, I mean, fetal tissue, the fetal stem cells, that's not used. That's completely illegal. Nobody does that. What most people use is either the patient's own bone marrow or fat cells. There are some people that use donated umbilical cord stem cells, that kind of stuff. I personally am more of a believer in using your own stem cells. I'm not really into that other stuff, but there are people that do that. Yeah.
Let's talk about what you just said. I like that.
Sure.
You said you're more into using your own stem cells instead of somebody else's stem cells. Is that correct?
Yep. Yeah. So, I just believe that when I go into your bone marrow, I know what I'm getting. There's no doubt that there's stem cells there. With some of these companies that make these products, there's a million companies. The FDA really has come out pretty negatively against them. So, they're obviously not being regulated too much. So, you don't know what you're getting. There have been a couple of instances of infection because of that, like 13 people got infected because of a batch. I've been to some of the orthobiologic conferences that have, people have done independent studies and really say there's no stem cells in there. So I tend to just, I've been using bone marrow for a long time. And it works great. What a lot of people are going to say against bone marrow is age. Okay, older people, their marrow isn't as good, and I don't believe in that. I've done bone marrow injections on people well into their 80s, and they have great results. I believe it's more kind of how you're made, your protoplasm. If you have bad genes, you're probably going to have bad stem cells, so you could be 35 and have a lot of chronic illness and your stem cells probably aren't going to be that good. Or you could be 95 and you can be healthy and you'll get great stem cells out of people, so.
That makes a lot of sense. And here's a question for you. I've just kind of came to me. Let's just pretend before I was born, my parents, took my stem cells out. And, whatever, they took my stem cells out. And then when I got older, I was able to utilize those stem cells. I was thinking that'd be cool if they actually started to do that. I don't know, they
do that, but it's more for, they do that, but it's more for like leukemias and that kind of stuff. Yeah. They don't really use it musculoskeletally. And also,
but you could, right?
I'm sorry?
But you could, correct?
You know what? I mean, I don't see why you can't, but yeah. I actually have been asked the question a couple times and I did look into it and I wasn't able to get it. So, they don't allow it for that kind of stuff, because someone did ask that question and it made sense, they still had it, but yeah, it's just something that I don't know why, but there's a lot of red tape with that right now.
Huh. Yeah, that's interesting. I was just thinking in the top of my head, I go, that would be actually pretty darn cool.
Yeah, well, the other thing, though, is, you have to pay every year to keep that cryogenically frozen. And if you keep that forever, I think it's a couple $1,000s every year you have to maintain.
You know what? You're right. I'll
might as well just pull out your stem cells when you need them.
Hey, we'll just throw some PRP on there. We'll be good to go.
Yeah,
We'll make my old ones come to life.
absolutely.
Awesome. So what would you say that you're seeing? Let's just use this as an example of some people. I know we can't say any names, but let's say somebody came in there and they had something wrong with their knee, you know, for the past, whatever, 10 or 15 years. And does it take about a year to two for them to get better? Are you seeing an average of each, because each person's different? Is there like an average that you see people where they start to see really good results? Does it take a year, 6 months, 3 months?
With the regeneratives, I would say for most people, about 6 to 8 weeks, they really start noticing a difference. You know, and then by usually like 4 months, they're really feeling pretty good, most of them. So now PRP might take more than one injection. You know, stem cells, usually I will do one stem cell injection, and then if I feel like I'm not getting where I need to go, I'll try and boost it with some PRP. I really won't rush to another stem cell so fast.
Right.
You know, I sometimes for PRP, you can do up to 3, or, you know, if they're improving but still not there, you could even do a 4th or a 5th, just depending on how it goes. I personally, with my PRP, I like to wait about 8 to 10 weeks in between injections, just because it takes 6 to 8 weeks to know if it's working. You know, everybody has their kind of own formula, but I haven't seen one that blew me away or that you can prove works any better. So for me, I just try and do the least amount that works, right? Because, you know, we know these things are not covered by insurance. People are paying out of pocket. So if I can get you better with one PRP instead of hitting you with 3 of them, that's what I'm going to do. You know, so I would say probably what I've seen in my practice is probably for things like tendon injuries, probably 30 to 40% of the time, 1 is all they need, and they're good, you know. So why do those other 2 or 3 for those people when you don't need to?
So I know for a fact, if I were to go in with surgery for my knee, I would probably be out for 6 to 8 weeks, maybe longer, depending on the type of surgery, you know.
Yeah, it could be 6 months to a year.
Yeah, up to a year. You're right.
Yeah.
Or, you know, we're not talking about stem cell, or let's say I do the surgery from, we'll say, you know, 6 months to a year. And then my insurance, of course, will still only cover just a minimum. And I'm still spending $50,000 to $80,000, depending on the type of surgery, you know, out of pocket. So what really works? So let's talk about those people that say, you know, I can't afford it. It's too much. I'll just do the surgery. Let my, let them take care of it. What would you say to people like that?
Well, you know, I mean, for some people it is a money issue, but for a lot of people, you have to make them realize that if they are still working, the amount of downtime and lost time that they're going to have, you know, can be many stem cell procedures. You know, so you know, for yeah, you're losing a lot of time too. You know, where, you know, although it takes 6 to 8 weeks to feel better with stem cells or PRP, you're walking right out of the room, you know, and within a week, I tell you to take it easy for about a week, but you could start going back to whatever you were doing a week later, you know, so you're talking no downtime. You know, you just have to let them know you're not going to, you're going to feel like you did before for that first 6 to 8 weeks, but you can do what you were doing. You don't have to, you know, sit there and be laid up that long.
No, yeah, I love it. And this is out. So we have a lot of viewers out there that's in the New Jersey area, around the world. And here's the great thing about Dr. Daniel is that a lot of people come around the world just to go see him, you know, for stem cells or for PRP. He also does, you know, a PRP facelift. You and I were talking about that. I love that. That's what I want to do. I want to try that. Just try it, you know, so I could be the guinea pig. But here's the thing, everyone. If you're looking at either looking at surgery or you're looking at possibly getting a stem cell shot, let me explain something to you. It's going to be worth your money 10 times over to do stem cell. And let me tell you something. It's not as expensive if you were to get a surgery. Surgeries, you're going to spend at least 7 to 8 times more. Everyone's different on what they charge, but it's worth it. And you're not going to be on your downtime, you know, and with surgery, you're like, I don't even know if it's going to work, but let me tell you something. I would make a recommendation to everybody out there, my viewers, try stem cell first. And if that doesn't work too well, hey, then possibly look at that. You know, everyone's situation's different, you know, but I just wanted to kind of throw that out there because it's not expensive. I don't believe stem cells expensive when you compare the versus from surgery to a stem cell shot or having PRP.
Yep. Yep. And I mean, obviously, if you're coming from far away, you can't come and see me consistently. But for local people, I mean, I believe in you try the lowest first and you build your way up. So I probably talk more people out of PRP and stem cells than I talk into it, because they come to me, their knees hurt, they have some arthritis, but they haven't tried anything. So you know what? You're going to try some physical therapy. You're going to try a brace. You're going to try a steroid injection. You're going to try the hyaluronic acid injections because they work on a lot of people.
Right.
And when they either don't work or stop working, then you have PRP and stem cell, and it buys you that time,
Right.
So it's just, I believe in step one, because once you go to step 10, you can't go back to the other 9 steps, so.
No, I love it. Now, probably, I'm sure you get this asked all the time. Have you ever tried PRP on yourself, or have you ever tried stem cells?
I have not. I am actually, I want to have one of my buddies inject me though, because I do have a chronic wrist injury that I think could really use it. But other than that, I really don't have a lot of pain. I've been lucky to stay pretty healthy and pretty injury free. So I haven't really needed it. So yeah.
Have
But
do
the wrist,
you guys do exosomes?
I do not do exosomes right now. I'm still kind of waiting for a couple of things that recently happened to just I want to see where the dust settles with that before I really kind of jump in, and again, I think your stem cells still probably work a little bit better. The other thing with exosomes is I think exosomes in and of themselves don't do a whole lot. I think you have to mix them with things like PRP to really kind of get the jet fuel going, so and then at that point you might as well do the stem cells because the cost is the same, and you're getting your own stem cells. Your stem cells are making the exosomes, all that stuff is there, so
Okay, awesome. So would you say that PRP can help people out? I just had a text from somebody, and PRP with like arthritis.
So it definitely helps with arthritis. Again, I think for arthritis, I think the stem cell is probably the better injection, but again, there's a different cost point. There's a different, there's more involvement when you're getting bone marrow or fat, so for some people, just the simple blood draw and the cost point is better to start with PRP. And you can always progress from PRP to stem cells later on if they're not getting the results they're looking for, so I will tell people, listen, PRP works, but I think the stem cells are better. If they decide to go the PRP route, that's fine, because people do really well with it, but some people need to take that extra step.
No, I totally agree. I call it baby steps. Because it's good to start out with a lower dose first and then work your way up instead of, because not only that, it's also good on, I call it good on price.
Yeah. I mean, but the good part about the regenerative treatments is that there's really no wrong answer, because listen, you can't be allergic to yourself. You can't have, adverse effects to yourself. So if someone says, hey, you know what, for the joints, the stem cells are the better treatment, I just want to jump to that, that's fine, but if they do want to do the PRP first, that's fine too, either way, I think they'll be okay. They just might, if they don't get what they're looking for out of the PRP, they might have to go to the stem cell.
I love it. No, that's what I'm saying. And just like with what we said that the topic is keeping people out of the operating room. Everyone, that's not always the last answer. Let's make sure that, you guys, if you have a regenerative medicine doctor in your area, please talk with them. If you are in Tinton Falls, New Jersey, and what are some of the surrounding areas that you're taking care of right now that you see people coming from?
So we're basically Central Jersey, Jersey Shore, so we got a lot of the shore towns. We, at my old practice that I used to work for, was in Staten Island. So we get quite a few people that take the trip down from Staten Island. But I mean, I've had people come from Canada. I've had people come from Germany. I've had people come from different states. So, we get people from all over the place, but obviously our home central area is kind of right in that Central Jersey. Yeah, Monmouth County area. Yeah.
Okay, that's awesome. No, I love it. And so everyone, so if you're looking for, if you're looking for PRP or you're looking for stem cells, please check out Dr. Daniel Savarino. You can find him at regeneratенj.com, regenerateenj.com. And again, I just want to say thank you so much for being on the show. Very informative.
Yeah, thank you. Yeah, I'm always here to answer questions, and and when people become my patients, they have access to my email. I answer them 24 hours a day. I really I like to inform people, and I like to let people know all about all the stuff. So
I love it. And guys, you can find Dr. Daniel at Ask Dr. Dan on Facebook and Instagram and YouTube. You can ask him questions, and he'll get back with you. And
so the Facebook is Apex Center for Regenerative Medicine, and the Ask Dr. Dan segment's on there. And then YouTube is also Apex Center for Regenerative Medicine, and Instagram is Regenerate NJ.
okay, so regenerateny.com, then Apex Center for Regenerative Medicine. So that's for the Apex Center for Regenerative Medicine would be for Facebook, Instagram, and YouTube.
Facebook and YouTube, and then Instagram is Regenerate NJ.
Okay, awesome. We have so much. We have so much social media. We don't even know where we're going.
I know. I think I asked my marketing person what all my handles were because I forget it.
Oh, you're all at Ask. Oh my God. Anyways, the cool thing is I'll make sure everyone that we have this here at the bottom of this video here, and the link. You just click on them. You don't have to type it out. And everyone, remember, sharing is caring. One video could change one person's life. Let's make sure that's you. So if you're not in pain, there's somebody on your social media that I'm sure is. Anyways, have a great day, everyone. God bless you all. And thank you so much, Dr. Daniel.
Thank you so much for having me.